at Dr. Stewart's office, getting ready to get a skin exam. As I've talked about before, melanoma is a danger here in Idaho. It's important to get yourself to Dr. Stewart and others here at the Dermatology Clinic of Idaho. Dr. Stewart, thank you for seeing me.
Thank you very much for coming in today, Kevin. So we're going to be looking you over. I'm looking for anything that looks suspicious for being skin cancer. And we'll start with your face and work our way down.
Sure. Now, being a high risk, like myself and like a lot of folks in Idaho, what does that mean? If you could describe that while do you need me to stand up at all? Okay.
No.
If you can just go over that while you're examining me, that'd be great.
Okay. Well, your skin is very fair. You have blue eyes, light-colored hair, and these are known risk factors for developing skin cancer. You also, in talking with you earlier, have a history of sunburns, and these sunburns contribute to the risk of melanoma later on. And so it's important to keep an eye on your skin and make sure you don't see anything that looks like a melanoma, and to come in for exams to make sure that there's nothing suspicious on you.
Okay, so let's get started.
Okay. I like to start at the top and work my way down, and so I always look at the scalp and see if there are any suspicious spots there. Then we go down to the face and just look for anything dark and irregular, or any spots that have characteristics of the more common skin cancers, which are basal cell and squamous cell carcinomas. I like to look at eyelids to make sure there's no abnormal growths in those areas or on the lip. It's important to look at the ear, and especially behind the ear, because patients can't see back here. So look at the other side. So far so good. And then on neck, I see you have a few little red spots on your skin, and those are harmless blood vessel growths. And then we'll look at your hands. And then it's important to look at the bottom of the feet. Sometimes melanoma will form on the bottom of a patient's foot. So if you can't look at your own foot, it's good to ask somebody else or a healthcare provider to look at the bottom of your feet and just make sure that nothing abnormal is growing there. And it's good to look in between the toes too. So I see that there are a few spots that we'll note on this leg, and perhaps treat in the future. Okay, so that's basically what I do. I also have patients take their shirts off, but we've already looked Kevin over and examined his back, chest, abdomen. We've already done that. And so it's good to have the healthcare providers look at all of the skin surfaces, because we're often not aware of other places that, like on our back, that might have something abnormal on them.
And it's really comes down to, if you see something, say something, and call a dermatologist and get yourself checked. That's so very important, right?
Yes, very important, especially if it's has the signs of melanoma, which these top 4 pictures are melanomas. We're asking patients to watch for anything dark that has other colors mixed with it, like pink or flesh-colored areas or lighter brown, borders that go in and out, and that's spreading outward. Often these melanomas start out being flat, so you're not necessarily looking for a bump. It's more often starts out just as a flat, dark spot, and then grows into something like this.
Thank you, Dr. Stewart.
You're welcome, Kevin.
And there we have it. Easy, thorough, concise.